Welcome back to Dr. Akil Medical Lectures. I want to start today with the question: if a patient comes to you with an asthma attack and you give them a nebulizer, a bronchodilator, they feel better almost immediately. Their chest opens up and the wheeze disappears. So why can't we just send them home on a bronchodilator alone? Why do the guidelines insist that almost every asthmatic needs an inhaled corticosteroid? The answer lies in the two-phase reaction of asthma. If you treat only the first phase, you are leaving the patient defenseless against the second phase, which is the one that actually kills. In this video, we are going to master the definition and pathophysiology of asthma. By the end, you won't just memorize the cytokines, you will understand the logic behind every single treatment we use. Let's begin. First, let's nail down the definition. What exactly is asthma? The textbook definition says it is a chronic heterogeneous inflammatory disease of the airways, but that's dry. What does it look like inside the patient's lung? I want you to remember the three S's of asthma. The three S's. These are the swelling, the squeezing, and snort. Swelling. This is the chronic inflammation of the airway wall. Squeezing. This is the bronchoconstriction, the smooth muscle tightening. And snort. This is mucus hypersecretion. Many students ask, sir, COPD also has swelling and mucus. How is this different? This is the most critical concept for your exams, the reversibility. Yes, the reversibility. In asthma, the obstruction is reversible. If you give a bronchodilator, the airway opens back up. In COPD, the damage is fixed. This concept of reversibility is the key to diagnosis, and we will come back to it. Now let's dive into the pathophysiology. This is the why. At its core, classic allergic asthma is a type 1 hypersensitivity reaction. It all begins with a trigger, let's say it's pollen or dust mites. This allergen enters the airway and is picked up by a dendritic cell, an antigen-presenting cell, also known as APC. It presents this allergen to a specific type of T cell. This is known as the type 2 helper T cell. The type 2 helper T cell is the conductor of this evil orchestra. Once activated, the type 2 helper T cell releases a specific set of cytokines. For your exams, you need to know the big threes. The big threes are interleukin 4, interleukin 5 and interleukin 13, also known as IL-4, 13 and 5. Let's break down what these three cytokines actually do. I will use analogies to make them stick. So first of all, the IL-4 or interleukin 4. The gunsmith IL-4 tells your B cells to stop making normal antibodies and start mass producing IgE. This IgE travels through the blood and coats the surface of mast cells. You can think of mast cells as the grenades of the immune system. They are packed full of toxic granules just waiting for someone to pull the pin. And thanks to IL-4, the pin is now loose. And now comes the IL-5 or interleukin 5, the recruiter. IL-5 travels to the bone marrow and recruits eosinophils. Think of eosinophils as the acid throwers. These cells contain toxic chitinic proteins that burn and damage the lining of the lungs. And now the interleukin 13 or IL-13. This is the architect, the one that is often forgotten, but it's crucial. IL-13 tells the goblet cells to produce massive amounts of mucus, the snot, and it drives the structural changes known as airway remodeling. So now we have the grenades. These are the mast cells primed by IL-4 and the acid thrower eosinophils recruited by IL-5. This sets the stage for the attack. Now the two phases, the fast phase and the slow phase. Now the patient breathes in that pollen again. This triggers two distinct phases. This is the most clinically important part of the lecture. And phase 1 is the early phase reaction or the fast problem. Its timeline is minutes. It peaks within minutes. Its mechanism is as the allergen lands on the mast cells, the grenades, it cross-links the IgE and boom, the degranulation occurs. The result is the mast cells dump histamine and leukotrienes, and these mediators cause the immediate bronchospasm, the muscle squeezes. And what is its clinical link? This is why the albuterol or Ventolin works instantly. It relaxes these contracted or squeezed muscles. But remember the question I asked at the start, why is not albuterol enough? And now we will talk about the late phase reaction or the slow problem. Its timeline is within 4 to 6 hours and its mechanism is as the eosinophils finally arrive. Recruited by IL-5, they release toxic proteins that strip away the epithelial lining of the airway. This causes massive edema and inflammation. Albuterol doesn't fix swelling. You can't relax a swollen wall. This is why patients who only use albuterol eventually end up in the ER, and how it is clinically correlated. This late phase is why we prescribe inhaled corticosteroids or ICS. Steroids kill the eosinophils and stop the late phase before it destroys the lungs. And now we will talk about the airway remodeling. Finally, what happens if we ignore the inflammation that is going on? What if the patient just uses their rescue inhaler for years and ignores the controller meds? We get airway remodeling. The chronic damage from the eosinophils causes the body to try and heal itself, but it does it poorly. The basement membrane thickens. It is termed as fibrosis. The smooth muscle gets huge, known as hypertrophy. New blood vessels form. It is angiogenesis. These are caused by chronic inflammation. Once remodeling happens, the airway becomes stiff and narrow permanently. The obstruction is no longer fully reversible. And now we will summarize. Asthma is a three-part problem: swelling, squeezing, and snort. The early phase is the squeezing, treated by bronchodilators. The late phase is the swelling, treated by steroids. But what triggers this chain reaction in the first place? Is it just pollen? What about aspirin? What about exercise? In the next video, we will break down the etiology and triggers of asthma, including the famous Samter's triad. Don't forget to like the video and subscribe to my channel for more crystal clear medical concepts. Thanks for watching.